Hi everybody, I'm Dr. Jordan Williams. Today's 3-minute injury report is about rib strain. What happens, what is it, and how you can help get it fixed. Rib pain. It can be pretty painful. How does it happen? Why do you get it? Well, many times what happens is you have rib pain because you have broken ribs. You get broken ribs because, like I did, you wreck on your bike and your ribs meet your handlebars. It's not super fun, but it can definitely be painful. Luckily, there's a few things that you can do to help decrease that pain. If you have x-rays and you're cleared for having rib fractures in there that are displaced or anything that's going to be dangerous, you can start getting some of those ribs mobilized, and we're really focusing on the muscles in between the ribs, getting those mobilized. Many times we see rib strain and pain from somebody just rotating too far or too hard, and these are going to be helpful for those situations as well. So today I'm not going to draw the ribs out because it's a little bit complicated, but what I want you to think about is they're just parallel bones in there, and we're working these little tiny muscles in between there. So the first exercise that we're going to go over today is more of a side-lying motion here. So lie on the side where the ribs that are painful are on the upside, and you're going to take that arm and reach over your head, and when it's over your head, take a nice deep breath and then come back down. You don't have to crunch, you don't have to do anything super intense. You're really just trying to get some mobility in there. You're trying to get some movement as you're coming back and forth, back and forth. Do about 10 or 15 times on that. You can even integrate some breathing with that as you bring your arm up over your ribs. You're trying to expand them, take a deep breath, and then come back down. The second one is related to breathing. When you have a rib injury, it's difficult and it's really painful to breathe. So what you want to do is practice some of that. So put one hand on your stomach, one hand on your chest, and you're trying to inhale and expand your chest as far and as big as you can, and then out. You want to think about, this is not diaphragmatic breathing, this is different. You want to think about trying to make your chest expand as much as possible and then come back down. Expand as much as possible and then coming back down. What you're focusing on, what you're concentrating on, is getting these rib muscles stretched out as much as possible. When you have an injury, they tend to tighten up and really limit the amount of activity that you can do. So, give these two simple things a try for a couple of weeks. See if they help. If they don't help or things are starting to get more painful, definitely let us know. We'd love to be able to help you out with that. If they do help and you start to notice that your pain is decreasing, we'd also love to hear about that. So drop us a comment in the box below. We hope to hear from you soon. Thanks.